think that's on. So, hi everyone, my name is Dr. Caroline Taylor-Walker, and I'm here with Mel today, who's a local functional nutritionist and works with us as well. So today we're going to have a little chat about fertility. So thanks very much for joining us today, Mel.
That's okay. Thanks for having me.
So, Mel, you've got a little bit of a story yourself, haven't you, which actually led you into this area. So, yeah, maybe we'll start by you telling us a little bit about your fertility story.
Yeah, okay. Well, that's how I got started into the whole functional nutrition industry, I guess. So I was mid-30s and decided to try to start getting pregnant, and it wasn't happening. So I went to the GP and said, look, I'm not getting pregnant. And they did some testing. My hormones came back low. But they didn't know why, or they didn't try to investigate why. So they sent me straight to an IVF clinic. So I went to the IVF clinic, and before I knew it, I was in the cycle of doing ovulation inductions, and I did 2 rounds of IVF, and I just wasn't asked any questions about why or what was my lifestyle like or anything like that. But I thought if I knew why, then I'd be able to solve the problem. So I started researching myself, and then that's where I discovered functional diagnostic nutrition and started studying that. I come from an exercise science background, so I felt like I wanted data to understand what was really going on for me. So in that course, we did a whole lot of functional testing. And as we moved through the course, you used yourself as a case study. So I did all these functional tests on myself and discovered things that I didn't know, like I had Helicobacter infection. I had low cortisol output. I had postmenopausal levels of progesterone, low estrogen. My estrogen was heading down a really toxic pathway. I had high inflammatory markers and low antioxidant status. So I had all these, now I had all this information, I could work through solving these issues. So I did. I started eating better, more nutritious food. I started exercising less. So I came from a history of, or a background of competitive swimming when I was a teenager as well. So lots of training, lots of hours in a chlorinated pool, and not enough eating. So that caused hypothalamic amenorrhea, which was missing period. But none of this was discussed at all. And so I kind of healed myself and did more stress management. As well as all this going on, I was flying around the country, running a national program for a not-for-profit organization. So all this, my stress bucket was just full. But I didn't know, I was in a happy place. Like I was just about to get married. We were thinking about starting a family. Like none of these, I didn't think any of these issues were a problem, but they were. So I stopped IVF and I ended up conceiving Indy and Noah naturally, which I'm really fortunate to have been able to do that. I know that's not everybody's journey, but you know, there were things that I could do without having to go through IVF, and that's what I realized.
Yeah, fantastic. It's even just having that little bit of control though, isn't it? And understanding, you know, why things might not be working. Even if you can't get them working, at least you can have some control there, which is nice to have. So what are the kind of most important things to do to improve your fertility from your perspective?
Yeah, there's a lot that you can do to improve your fertility without having to go through IVF. Definitely that is there for good reasons, and some people need it, but I feel like there's a massive gap. So I think the first thing we need to do is know your cycle. So know when you ovulate, and if you're even ovulating, know how long your cycle is, and then you will know the right time to have sex and to get pregnant, because it's only a short window of opportunity that we can do that. So knowing your cycle is pretty important.
Yeah, definitely. So ovulation is obviously when the egg is being released. So that's the most important time to try and capture that egg. So how do women know when they are ovulating?
Yeah, there's a few different things that you can do. So I like women taking their temperature every morning at around the same time with a basal thermometer. So a thermometer that you put under your tongue. Now, if that increases by about 0.3, after you ovulate and stays elevated for the luteal phase, for the second half of your cycle, then you have ovulated. If that rise doesn't happen, then you haven't ovulated. And then when you bleed, your temperature drops down again. So that's a really easy thing that you can do at home to see if you are ovulating regularly. And then there's observing your fertile mucus. So we have most mucus just before we ovulate. So it'll be kind of sticky and see-through. So that's your most fertile time. So you know if that is happening, then to have sex at that time as well. Other things that you can do is using an LH stick, or a luteinizing hormone stick. And they're kind of like little pregnancy tests where you pee on the sticks, and then you'll get an LH surge before you're ovulating. And you know that you're going to ovulate in the next 24 to 48 hours. So you know to have sex in that time as well. And then there's something called the daisy. Have you heard of the daisy?
No, I haven't actually. No, not on my side.
Yeah, so that's a good one. That's like a fertility monitor as well. It's basically like a thermometer. So you take your temperature every morning under your tongue, but also you can add information and data into that. So information about your cycle. So the longer you use that for, the more accurate it is. So it gives you a really good indication about when you're fertile. So it'll be red when you're fertile, flashing red when you're ovulating, and then green when you're not fertile. So it's a good thing to have when you're trying not to get pregnant as well. So you know when your non-fertile days are.
Yeah. So with that in mind, so if you get to grips with those and obviously able to work out when you're most fertile, or when you're ovulating, when should you then be having sex?
Really within about a day of ovulating, because the egg, you can really only get pregnant within 12 to 24 hours of ovulating. But then the sperm can stay inside and alive for up to 5 days. So it's really not that much time in a cycle where you can get pregnant. So you really need to know when you're ovulating to make that happen.
Yeah. And that's where I've always really found that interesting, how long the sperm can actually live for. And that's where people can have those surprise pregnancies, because they feel that they weren't ovulating at the time. But obviously, if you ovulate on day 14 and you have intercourse on day 10, you potentially could still get pregnant that month, and people don't understand why. So it's worth knowing those. They're quite a long lifespan, those sperm.
Absolutely. And that's why it's good to know when you ovulate as well, because then you have sex before you're going to ovulate, so you know that there's going to be sperm alive in there before you ovulate.
Yeah, sounds good. So if a couple, say, have been trying for about 12 months and then not getting pregnant, what would you then recommend?
Definitely doing all of the above that I've just spoken about. So finding out when you're ovulating, but investigating more. So going to your GP and getting bloods ran. So seeing what your FSH, follicle stimulating hormone, LH, luteinizing hormone, estrogen, progesterone, androgen studies, thyroid stimulating hormone, and then seeing what your nutrient status is as well. So like your B12 and your B6 and your folate and your zinc and your vitamin D, just to get an overview, is there anything kind of going out with those markers? And if there is, then yes, let's fix those. Other than that, we need to look at the male as well, because the male is 50% of the party. Yeah. So a lot of the time I get females coming in and they've been doing all this work, but the male hasn't done any investigation at all. So we need to do a semen analysis for them to see what their sperm quality is like. And then we need to address any underlying hormonal condition. So if you've got any hormonal condition, it is going to make it harder to get pregnant. So those things can be post-birth control syndrome. So once you almost forgot that one. So women that have been on the pill for any period of time and then they come off, don't necessarily go back to just having a regular cycle, a 28-day cycle, and their optimal fertility. So it takes a while for the brain to start communicating again with the ovaries, and the pill puts you into chemical menopause. So, so you may have absent periods after coming off the pill, or you may have androgen excess, or some, you know, some different things going on from coming off the pill. We need to look at PCOS, whether you've got PCOS as well, so polycystic ovarian syndrome, and what type of PCOS it is. So there's different types as well. Whether you've got endometriosis or adenomyosis, whether you've got amenorrhea. So we really need to investigate underlying hormonal conditions to optimize fertility.
Yeah, it's quite interesting around the pill as well, because sometimes what I find is women have gone on the pill when they're, say, 16, 17, 18, and have stayed on that pill and are coming off when they're 30, and their periods aren't regular, but often there's a condition that's not been diagnosed before, because at the age of 16 and 18, when they had irregular periods, they were just put on the pill. It's quite a common thing to do 20 years ago, and you could well have, for example, polycystic ovarian syndrome, or an underlying issue with the periods that have just not been diagnosed for 20 years. So sometimes I think coming off the pill a little bit sooner and just seeing what your natural periods are like anyway, whether you have got an underlying condition, can be quite useful.
And if you went on the pill because you did have one of those underlying conditions, then the pill isn't going to solve that underlying condition. So you could have that condition the whole time you're on the pill, you just don't notice it as much. And then when you come off the pill, you're still going to have that underlying condition, and it could even be worse than what it was.
Yeah, it's just been hidden for a while. So
yeah,
it's good to know. So then, being a functional nutritionist, and you do functional testing, what are some of the tests that you would then do for fertility patients?
Yeah, I like to do a comprehensive gut test just to rule out if there is any gut infection. So like I had Helicobacter bacteria, and that creates a lot of stress and inflammation in the gut. And we're always trying to reduce inflammation in our body for optimal fertility. So ruling out infections and then treating the infections is beneficial for fertility. 80% of the immune system is in the gut as well. So we want that to be in good health as well for optimal fertility. And then if there's any problem with elimination, such as chronic constipation, and we're not eliminating properly, then that means that hormones and drugs and pesticides can recirculate through our body because we're not excreting them out, and cause inflammation, which can have an effect on fertility and pregnancy as well.
Sure.
Another test I like to do is the Dutch test, so the dried urine test for comprehensive hormones. So that not only measures the levels of the hormones, but the pathways that they go down. So it's like having a map of what your hormones are doing. We can also see the cortisol picture on that. So what is our stress like? How much cortisol output do we have? It measures some neurotransmitters and our antioxidant level as well. So that we just see a few different nuances in that test that we can just tweak, and that can make all the difference to fertility sometimes. Another great one I like to do is cycle mapping. So again, that's a urine test, but we map your cycle over a whole, over 35 days. So we can see exactly what your estrogen, progesterone, follicle stimulating hormone, and luteinizing hormone are doing. So that one's really beneficial. And then there's various other tests that we can do as well. If I haven't got all the information I need from those tests and there's still underlying things going on, then we can do tests like mold toxicity, heavy metal testing, and genetic testing, and other things that I think that we would need to investigate.
Yeah, great. So kind of individualize it to the patient.
Yeah.
Yeah. I really wish that as doctors we could do the 28-day hormone testing. I don't understand why we just do the kind of snapshots on a one day. I really don't think it gives a good picture of really what's going on.
It doesn't. And how often do you get clients coming in saying, I've brought my hormone test with me, and they don't know at what stage of their cycle they've done the test, so it like really becomes irrelevant. Yeah. So yeah, knowing exactly what was happening throughout the whole cycle would be amazing. It kind of makes sense, doesn't it?
Yeah, I think within medicine, the hormone test kind of tells you whether there's something really severe going on, for example, a higher up level in the brain or something. But yeah, if it's just a one-off blood test on a one-off day, it doesn't give you the picture of what's happening on a full cycle level at all. So
Yeah.
those testings sound great. So if somebody wanted to optimize their fertility, what kind of nutritional changes would you recommend? Something quite simple that they could do.
Yeah, I like them to follow three main principles, and that is to have a nutrient dense, real whole food diet, to have a diet that takes out all the stresses, and to have a diet that suits their circumstances and their physiology. So underlying that, I like people to have a lot of cruciferous veggies. So they will help bind up toxins and excess hormones and help you excrete them out of your body. So that's things like bok choy and cauliflower, Brussels sprouts, all those foods. And then there's sulfur-rich, all the things that we love. Then there's sulfur-rich foods as well, which really help with phase 1, phase 2 liver detoxification. So that's your smelly foods like your Brussels sprouts, your eggs, your leeks, and your garlics. And then we want essential omega-3 fatty acids. So they're really anti-inflammatory to the body. And we want to reduce inflammation as much as we can to optimize fertility. So that's like chia seeds, flax seeds, fatty fish, nuts and seeds. And we want clean proteins as well. So the clean proteins are like your fish, your egg, your chicken, organic chicken, grass-fed beef and lamb. And we really want protein because it means that you're getting all your amino acids, which are really important for healthy hormones, and for hair as well. Yeah. Slow carbohydrates are super important for hormones. And I find like there's a lot of fad diets at the moment, like keto, or even just really low carb. And females, they really need good quality, slow carbohydrates for optimal health. So that can cause hormonal dysfunction and chaos when ladies are too low carbohydrate. So the slow carbohydrates are things like your ancient grains, like millet and quinoa and teff, and then your starchy veggies are great as well. And then some drinks that you might want to include instead of coffee, matcha tea, lemon balm tea, which will nourish the adrenals, licorice tea, any kind of herbal tea is great. Kombucha, if you don't have a histamine problem, bone broth, and filtered water. We always want filtered water as well.
Yeah, it's interesting that you mentioned the carbs in women. I often find a lot of women, even if they're actually overweight, aren't eating enough. I think we really undereat with that mindset that if we don't eat, if we over-exercise and don't eat, we're gonna be skinny and have and optimize our health. But most of the time when I look at women, they're definitely over-exercising and under-eating. And then when they obviously do eat, suddenly they eat the wrong foods because they're hungry, which is interesting because in your story at the beginning, that was one of the things that you kind of mentioned, that potentially that over-exercising and under-eating went a little bit against you.
Well, that's what we were told in the 80s, weren't we? Like, you just need to exercise more and eat less. And
I know.
It'll, the weight will drop off you. But it doesn't work like that. We need to be eating adequate food for optimal hormones and health.
Yeah. So are there any foods that you would recommend to not eat, to actually avoid?
Yes, so again, we want to take out the stresses in our life and our diet. So that's things like alcohol and wheat and gluten. So the research shows that gluten pierces our intestinal lining to create leaky gut in everybody, not just celiacs. So in this time of creating optimal health, I do get some people off wheat. And then caffeine is not a good idea as well. It's acidic and it causes a cortisol stress response, which we don't want. And then any food sensitivities that the individual has will create a stress response as well. And that's going to be different for everyone. So for you, it might be eggs. For me, it might be blueberries. So if I feel like we need extra testing around that, we can do a food antigen testing. And then it will come up with the list of these are the foods that you are reacting to. It's an IgE test. So these are the foods that you have an allergy to that you should never, ever have again. But then there's these foods that you're sensitive to that you can rotate through your diet. And then these are the foods that you can have as much as possible. So that's a really great test. And it's always interesting when I do that. Somebody might be eating blueberries all the time because I think it's healthy, but they're actually having an IgE, an allergic reaction to that. So it is causing stress for them.
I often find with those testing that the foods that they absolutely love and eat the most is often the one that they come back with the allergy to.
Yep.
And I believe it's more the cortisol reaction. You kind of get addicted to it. So you eat food, your body has a reaction to it, your cortisol then goes up, so you feel good. You want more of it. Yeah, really interesting, because you look at the list and then you have to tell people that they have to stop eating them, and it's their favorites.
I know, like a hit every time they eat it.
Yeah. What about vegan products? This is only often find like there's a lot out at the moment about being vegan and the health benefits of that. But what I do find, I'm a bit of a label geek, so I go around even things that I'm not eating in the supermarket. I go around and look at labels all the time, and it really surprises me how a lot of the vegan products that are made, you go to the shelf and you go to the vegan aisle and you take off the products from there. A lot of those products might be vegan, but they're full of like gluten, in like inflammatory, like sugars, and that really surprises me. So would you just recommend again with those that it's just checking the label again, being careful that even if it says vegan on the front, it's not necessarily fully healthy for you?
Absolutely. And I'm seeing a lot of people that are choosing to be vegan for different reasons at the moment, which is fine. But reading the labels, because a lot of the vegan products are high in soy, which is not great for optimal fertility as well. And then trans fatty acids, which are not good for cholesterol and triglycerides, inflammation. So they can have like up to 30 ingredients on there.
Okay, I'm really shocked when I see them.
Yeah, they're eating healthy, but they're really not. So just being mindful. Some vegan products are healthy, but read your labels. And then I have some vegetarians coming in and they're not eating any veggies. And I'm like, if you're vegetarian, you've got to eat veggies. That's what being vegetarian is about. Yeah. And just being mindful, if you are vegan or vegetarian, then you are more likely to be vitamin B deficient, iron deficient, folate deficient, and zinc deficient as well. So I would recommend supplementing, testing and supplementing if you're deficient.
All right, great. So what are your thoughts on stress and how that impacts women and fertility?
It's the biggest thing.
The life we live in.
Yeah, it's the biggest thing, isn't it? So
I needed IVF.
Pardon?
No wonder I needed IVF.
Did you do IVF too?
Yeah, I did for my first. Yeah,
absolutely.
This was number one. It was stress. Yeah.
It was stress for me as well. So when I took the excessive exercise out, eating better, the gut infections I had going on, my body started working better. I wasn't in fight or flight. If our bodies are in fight or flight, then it's not an optimal environment to bring a child into, and our body knows that. So instinctively it shuts off fertility because it thinks that we're in danger. So we need to get out of fight or flight mode. And if you think about how many things in a day that can create that stress response, so it could be getting the kids ready to go to school, driving to work, and then having a coffee on the way to work, stress. And then at work, you might have a wrap, and that wrap's creating a stress response. So all day it's like stress, which means your body's producing cortisol. And then cortisol is made at the expense of progesterone. And progesterone we know we need for implantation, fertility, and pregnancy. So yeah, it's a lot. It's the biggest thing that I find that I talk to women about, and it's not psychological or emotional all the time. It's these other external stresses, but it's also the internal stresses that we need to look at. So I'll sit down with my client and we'll list all the potential stresses that they have in their life, and we'll work through mitigating them like one at a time. And once we mitigate all those stresses, then a lot of the time their fertility is enhanced and they feel better and their health is better for it.
Yeah, it's a massive impact, and it's not on fertility either. It has impacts on every single illness that I come across, and then the recovery from those illnesses, the side effects, the emotional side of the illnesses. So I do feel that stress is our number one issue in the world, I suppose, at the moment, or the developed world. Yeah. So the other thing, I suppose, I think a little bit related, similar to stress, is sleep. How does this affect your fertility?
Yeah, so this is also a big one, and there's been research showing that women who get under 7 hours of sleep a night are 15% less likely to get pregnant over women who get 7 to 8 hours of sleep a night. So it does have a massive impact, and sleep is where we recover and repair. A lot of the time at the moment, people are on Netflix or on screens, on phones, on laptops, watching TV, and that blue light will stimulate cortisol, which we definitely don't want to be high at night, and it blocks melatonin as well, which is the sleep hormone. And melatonin can have an impact on FSH. So if we don't have adequate FSH, then we don't ovulate.
What's so with the kind of TV and the blue screen, have you got a recommended time gap between, say, watching telly and sleep, or being on your computer and sleep? When should you be turning that off before bed?
Yeah, I say 1 to 2 hours before you're going to bed, turn off the screens. Or if you really want to watch TV, then I think in the other webinar I showed you like the blue blocking glasses that you can wear that block the blue light. But it's about behavioural change as well. So not watching TV anymore, not being on your screen, not scrolling, and going to bed and reading a book or doing some meditation or talking to your husband, or something else that's going to get you off the screen. It's so addictive, and it's really not great for our health. And a lot of people will say, oh no, I don't notice a difference, but then you take the screen away and they do notice that they get into a deeper, more restful sleep, feel better the next day.
Yeah. All right, great. So there are obviously people that are struggling, but some people obviously do go down the IVF route and either do require that as well. What about these patients? Is there anything extra that they can be doing to help the IVF be more successful?
I really think everything that we've discussed is important. You're already in the IVF cycle and you're already doing this, which I do see a lot of clients that they've done 5 cycles or even 10 cycles and it's not working for them. So they're looking at other options and they come to see me, and they have to go through IVF for medical reasons, or they're going to continue on that journey because they've got embryos. And so we start doing all the things that I mentioned above, and that is going to enhance your chance of getting pregnant through IVF because it's reducing inflammation and it's increasing the chance of implantation as well. So I was not asked one question when I went through IVF about my lifestyle, about my nutrition, I think there was a small psychological test, or like 10 questions or something. But nothing was discussed about anything either. So it's like, before you hand your fertility over to somebody else, then let's look at what potentially we can do. And we might not be able to, you might still need to go through IVF, but there is so much that we can do to enhance that as well.
Yeah, no, I had the same experience. I think I handed over my blood tests. That's the only information that I gave them. And they were like, yes.
You signed up.
So, what other things can couples do to improve their fertility?
So I'm a big believer in supplementation when we need it, when we have dysfunction and imbalance. So definitely being on a high strength or a good quality strength practitioner multivitamin. Generally not one that you just get from the supermarket because they've got fillers in them. So going through a practitioner and getting a high grade one that has things like activated Bs in them, which are more likely to be absorbed. There's something called CoQ10 as well, which is really important for mitochondrial health. So we want good mitochondrial health to help push out the egg that's really important. Then there's something called Vitex. If you have low progesterone, Vitex is a natural supplement that you can take to help increase that. It doesn't work for everybody, and make sure you speak to somebody because you might not need more progesterone. It might be another problem that you have. Magnesium is always my favorite because it nourishes the nervous system, and we need magnesium for over 300 metabolic processes. So that's super important. And then alpha lipoic acid or glutathione, which are master antioxidants. So that will help fight free radicals and reduce oxidative stress. And oxidative stress can really impact egg health, egg quality. So they're some important ones.
And can I just ask, is this for both the man and the female? Obviously not Vitex.
not Vitex. But we want the male to be on a male fertility multivitamin as well. And then through testing, if he was deficient in anything like zinc, then we would supplement with him too. But CoQ10 is great for males. And then glutathione is also really good for sperm quality and health as well, because it's just reducing oxidative stress for the sperm and enhancing their quality. Yeah.
Just to confirm as well, everything else we've discussed in regards to nutrition, reduction in stress, improvement in sleep, again, recommend the male is involved in that too. You know, the child has already started.
Yeah. Definitely. And sometimes there's been a couple of cases where the male's still smoking, and smoking has a massive impact on sperm health. So it creates a lot of free radicals. So yeah, it's like we need to bring the husband into some of these consults as well and do an overview of their lifestyle, not just the female's lifestyle.
I do find the men's forgotten about quite a lot. You know, it's driven by the woman, not necessarily just wanting to have the baby driven by the woman, but the woman's normally the one who accesses the healthcare and wants to improve things, and everything's very focused on her body, and the man can be forgotten about. And often when you then look at the man, they do meet a lot of the criteria we discussed in the women. Their weight might be wrong, they might be over exercising, stressed, eating the wrong type of food, like you said, maybe drinking alcohol, too much coffee, not sleeping well, like you said, the smoking. There's lots of things in their lifestyle that you then have a look at and think that needs improving too.
Yeah, absolutely.
So can you actually improve the quality of the egg?
Yeah, you can. And by doing all the things that I've spoken about, but sometimes you'll get the AMH reading, which indicates egg quality and how many eggs you've got. And you can change that. You can improve your egg quality. And that's by doing all the lifestyle factors. So improve nutrition, better sleep, some supplementation, stress reduction, all those things will help.
Yeah, fantastic. So obviously, when we discuss pregnancy, people think, oh, I'll come off the pill and then I'll fall pregnant. And I think the word fall just has that kind of feeling that it will just happen kind of overnight. And it's never discussed about planning, like actually planning the pregnancy in regards to looking after your body. So how long should couples kind of start doing these things before getting pregnant? Now, we often see them like 12 months down the line, don't we? It's quite common, we'll see them 12 months, a couple of years down the line, and they're not getting pregnant. So yeah, what can they do beforehand?
And we're told, like, we're kind of scared as teenagers and young adults because we think it's so easy to get pregnant, so we're told to go on the pill, and we're always trying to avoid getting pregnant.
We need to be proactive about it.
Yeah. But at least at a minimum, 90 days, 3 months, start incorporating all these lifestyle modifications and being on a pregnancy multi and improving your nutrition, because it does take about 90 days to develop an egg, to ovulate and to conceive. The male's a bit different. You regenerate sperm much more quickly and more often than that. But the male can go on the journey with you starting 90 days beforehand. But then if we have to look at the underlying hormone conditions, then, that process, if it's something like endo and you need surgery, and then you need to manage endo, it can take 12 months. It could take longer to even discover what the hormone condition is, and then to correct it and manage it as well. So yeah, if you are thinking about getting pregnant, then yeah, start doing all these things at least 90 days beforehand.
Yeah, fantastic. All right, great. So you've got a few issues with you, haven't we? So if people are considering getting pregnant, then it's worth coming and having a chat with yourself or GP to go over what they can do in that preconception stage to optimize health and optimize their ability to fall pregnant as soon as they want to start trying. And then obviously if people are struggling to get pregnant, then it's best to come and you can come and have chats as well. And then obviously if they're doing IVF, there's still room for improvement to either make the IVF work a bit better or potentially fall pregnant when you're off the IVF cycle.
Yeah.
That sounds fantastic.
And it's a lot of information. That's why I do fertility programs, 6-week programs or 4-week programs, because we really do go into each kind of topic in a lot of depth, and we do analyze their life. So for example, we'll look at the chemical load on someone's life and audit their skincare and their cleaning products and foods. So yeah, so it's not just a one consult. It's, it can be 4 to 6 consults, which is why I run the programs that I do at Ministry.
Yeah, which is fantastic because then everything is looked at. As you said, their lifestyle, what they're using at home, what they're coming into contact with, what's maybe happening at work. So really, it's the full body holistic treatments, which is what we should all be doing.
Yeah, all the time, not just for fertility.
Yeah, exactly. And and that's a good point as well, because this is stuff that they can continue forever. And I'm listening to this about the fertility, obviously, but in my mind, because I do a lot more skin things, for me, this is all anti-aging as well. This is all the stuff that I would say to people to continue doing to get the best sleep and longevity in life. Sorry, the best skin and get longevity in life and look younger during that time as well.
Yeah,
it's something that they can gain and just roll on through the rest of their life and benefit from.
Yeah, absolutely. So, and I just had a client last week finishing off one of the programs, and she was just so, like, we did the whole xenoestrogen chemicals, and I give a list of what chemicals to look out for, and she just said, I've just gone through all my skincare products and I've had to get rid of everything because everything's got chemicals. So she would have ended up putting on probably over 200 chemicals before she had even left the house. And she was just so thankful that she has that knowledge now for life, and she's educating her friends and her husband, because you don't know what you don't know.
I know, it's really shocking. And there's actually been research about what these chemicals do to your baby too, and to children when they're growing up. So putting these into place before getting pregnant is gonna, if you think about reducing that impact on your baby and your child forever as well, will hopefully make sure that these are put into practice for life. Yeah. Amazing. Well, thank you so much for chatting. Always love chatting to you and getting these little gold bits of knowledge out of you that we can all kind of start implementing in our lives. Well, if somebody wants to come and have a chat to you, how's the best way to contact you?
Yep, so I work at Ministry of Skin, and I also do telehealth for other people not local to the area, and I'm functional nutritionist on all socials.
Yeah, okay, fantastic. Brilliant. Well, thanks very much for taking the time to have a chat, and hopefully we'll set up another webinar soon about something else.
Great, looking forward to it.
Thanks, have a good afternoon.
Thank you.
Bye.
Bye.